Hello, good evening, and welcome back. This is Friday evening, and I'm very happy to be back with all of you. Thank you already for joining us tonight. We have another topic to discuss. I would say that it's like a summary because this week we were talking about nutrition, we have been talking about exercises, but we also talked about stress. And today we have all those lifestyle factors, and we have a doctor that will talk about it actually. As you can see, he is with us already, Dr. Adolfo de Prados from Vistahermosa PreGen Clinic from Valencia. So, hello to Valencia. Hello, Dr. Prados. How are you feeling tonight?
Hello, good evening. Good evening, everyone. I feel like very fine. I would like to thank the invitation to be here with all of you, talking about this topic that it's so interesting.
Thank you so much for, of course, agreeing to talk to us today and for your presentation already, because we have a presentation. Dr. Adolfo has prepared this for you. And as always, remember, we will start with the presentation, but afterwards it will be time for your questions. So please type those in the chat section, and Dr. Adolfo will answer them for you right after the presentation. And don't forget, it's being recorded. You will be able to watch this as well tomorrow. It will be available on our website, My IVF Answers. And as you know, My IVF Answers is a part of European Fertility Society, which has been brought to you in December last year, simply because we definitely want to focus on educating. We want to focus on helping our patients and supporting them throughout their IVF journeys, but also help them find some answers from our top fertility experts. And tonight, as I've mentioned, Dr. Adolfo, are you ready to start with your presentation?
Perfect. So here we go. I'm going to share my screen.
Wonderful. Go ahead.
So,
Yes, and
perfect. Yeah.
we see it. Okay.
Okay, perfect.
Excellent.
So before starting my presentation, for the people who have just joined to the webinar, I would like to introduce myself. My name is Adolfo de Prados, as Caroline says, and I work as human reproduction specialist here in Spain, concretely in Valencia. As you can see in the first slide of my presentation, today I'm going to talk about lifestyle factors. Infertility has become a pandemic problem that affects to 20% of world population, so decreasing the number of people affected by infertility has become a top priority for many health organizations. The purpose or the goal of this presentation is to demonstrate the potential effect of lifestyles on reproductive health for both men and women. Lifestyle factors can be modified to enhance overall well-being, and they are under one's own control. The first factor that I'm going to talk is not a truly a life factor, but the age of a man or a woman is a factor that can affect fertility. Due to pursuit of education and other factors, many couples are choosing to delay childbearing. But we have to know that fertility peaks and then decrease over the time in both in men and women. Thus, the reproductive timeline may be one aspect to consider when we are determining the ideal time to start a family. After the age of 40, men can have more DNA damage in their sperm, as well as a decline in motility and viability of the spermatozoa. When men are over the age of 45, their partner relative risk of an increase in time to pregnancy over 1 year increased to 4.6, and over 2 years increased to 12.5. The reproductive timeline for women is more complex than men. This is because a woman is born with all the oocytes she will ever have. She's not going to produce any oocytes. When she will born, she will have more or less 1-2 million of oocytes, and from them, only 400, 500 are going to be ovulated. Increasing age increases a woman's time to pregnancy. In fact, the number of infants born start to decrease after the age bracket of 35-39. The odds of becoming pregnant and maintaining a pregnancy are connected to numerous factors. One of them is the euploidy. The euploidy is the technical word that we use to speak about the correct genetic information of a oocyte and later of an embryo. We have to know that the euploidy has been found to be inversely correlated with the female age. The rates of euploidy decrease 50% for women under 35, decrease 40% for women between the ages of 35 and 40, decreases 33% for women over 40, and the possibility of have an euploid oocyte after 44 is less than 3%. But we can't modify our age, so we have to focus our efforts in lifestyle factors we could modify. The first one is the nutrition. Eating a healthy and varied diet may be a key part of maintaining a good overall health. However, there are certain vitamins and food groups that could have a greater impact on reproductive health. In males, consuming a diet rich in carbohydrates, fiber, folate, lycopene, as well as fruit and vegetables correlates with improved semen quality. Consuming lower amounts of proteins and fats are more beneficial for fertility. Another potential benefit could be the use of antioxidants. They play a pivotal role in the body by scavenging reactive oxygen species, also called ROS. ROS are a collection of free radicals and non-radical derivatives of oxygen, and an overabundance of them may compromise sperm function, including sperm motility, altering DNA, and decreasing the membrane integrity. The function of antioxidants is to help remove the excess of ROS in the seminal ejaculate and assist in the conversion of them to compounds that are less detrimental to the different cells. If you have more ROS than the local antioxidant can remove, it results in inoxidative stress that can be translated in a sperm dysfunction. Some vitamins like vitamin C, vitamin E, selenium, and coenzyme Q10 had significant effect on semen quality. In fact, a Cochrane review, including 34 studies, determined that men who used this oral antioxidant had a significant increase in live birth rate when compared to control. And obviously, a woman's diet might affect her fertility, particularly ovulation. Replacing carbohydrates with animal protein was demonstrated to be detrimental to ovulatory fertility. Adding just one serving of meat was correlated with a 32% higher chance of developing ovulatory infertility, particularly if the meat was chicken or turkey. However, if we replace that carbohydrates with vegetable proteins, it's demonstrated that it has a protective effect. If we talk on fats, choosing trans fats in the diet instead of monounsaturated fat has been demonstrated to increase the risk of ovulatory infertility. Consuming trans fat instead of carbohydrates correlated with a 73% increase in risk of ovulatory disorder. But the use of multivitamins and different supplements have a positive effect on fertility. Women who take multivitamin may be less likely to experience ovulatory infertility. Some authors have postulated the existence of a high fertility diet, and they emphasize by a higher monounsaturated to trans fat ratio, the consume of vegetable over animal proteins, a high fat over low fat diet, a decreased glycemic load, and an increased intake of iron and multivitamins. So it's demonstrated that nutrition is very important. So When we met a couple in the consultation, taking in account their weight, we can imagine his or her eating habits and the amount of activity that they can do. You can see in the picture is a table of body mass index. The VMI of body mass index is reported as a number. If it is below 18.5, it's considered underweight. Between 18.5 and 24.9 is normal. Above 25 is overweight, and over 30 is considered obese. Body weight can have significant effects on health, including cardiovascular disease, diabetes, and infertility. We have suffered an obesity pandemic, and this is a serious issue, particularly in industrialized nations. Obese men are 3 times more likely to exhibit a reduction in semen quality than men of a normal weight. Several studies have demonstrated that an increase in VMI is correlated with decrease in sperm concentration and decreased motility too, and have an increase in DNA damage in the sperm. In addition, exists a relationship between obesity and erectile dysfunction. In women, in a systematic review, obese women had a higher rate of recurrent early miscarriage compared to non-obese women. There is evidence that this miscarriage in obese women may not necessarily be due to the genetic alteration, because there is no difference in euploidy rates between obese and non-obese women, suggesting that miscarriage may be due to other influences, such as endometrium receptiveness. Obese women have higher rates of ovulatory disorder, so they are going to have a longer time to pregnancy than non-obese women. A positive aspect is that the negative effects of obesity may be reversible. They say that we are what we eat, but also what we do. So in this context, obesity is not the only way in which weight can impact fertility. Men who are underweight are also at the risk of infertility. They tend to have lower sperm concentration than those who are at a normal VMA. For women, being underweight and having extremely low amounts of body fat are associated with ovarian dysfunction and infertility. Additionally, the risk of ovulatory infertility increases in women with a BMI below 70. I repeat, we are what we eat, but also what we do. So the exercise is important. A healthy amount of exercise can be beneficial for men and women who are looking for a pregnancy. When I'm talking about a healthy amount, it means a moderate amount. Active men who exercise at least 3 times a week for 1 hour scored higher in almost sperm parameters in comparison to men who are sedentary. Nevertheless, bicycling more than 5 hours per week has been demonstrated to have a negative correlation with both total motile sperm counts and sperm concentration. So, excessive exercise can negatively alter energy balance in the body and affect the reproductive system. When the energy demand exceeds the energy intake, a negative balance may occur and in women lead to menstrual abnormality, particularly among women athletes. Increased frequency, intensity, and duration of exercise were found to be significantly correlated with decreased fertility in women. In fact, a study that examined more than 2,000 women undergoing in vitro fertilization found that women who engage in cardiovascular exercise for 4 hours or more per week 1 year prior to the treatment had a 40% decrease in live birth rate. So, as Aristotle would say, in the middle term is the virtue. But not all is physical. A psychological view is important. Stress is a prominent part of any society, whether it is physical, social, or psychological. And infertility itself is stressful due to the societal pressure testing, diagnosis, treatment, failures, and even the cost with which the infertility is associated. In a study that includes more than nearly 1,000 men with conducted stress, such as job, life events, or even social strain, were seen to have a significant impact on sperm density, total sperms count, motility, and morphology. It seems that semen parameters may potentially be linked to stress. In addition, stress and depression are thought to reduce hormonal secretion, to drive a disrupt gonadal function, and ultimately reduce spermatogenesis and sperm parameters. Although there appears to be a relationship between stress and infertility, it's uncertain which is the cause and which is the effect. For example, provide a semen sample is necessary to do a basic study of fertility for men. The stress of providing a semen sample was reported to be negatively linked to overall semen quality, with a 40% decrease in sperm concentration, 50% decrease in motility, and worse overall semen parameters, for example, on the day of oocyte retrieval. In women, physical stress has been implicated with fertility. Women who had a job and worked more than 32 hours a week experienced a longer time to conception compared to women who worked less hours. Psychological stress, such as anxiety disorder or depression, affects 30% of women who attend infertility clinics, possibly due in part to infertility diagnosis and treatments. Receiving instruction on how to deal effectively or merely receiving support made a significant difference for women undergoing fertility treatment. There was a higher pregnancy rate for women who were part of a cognitive behavioral interventional group or simply a supergroup than for those women who were not receiving any intervention. Women who receive support and counseling may reduce their anxiety and depression levels, so it results in an increase in their chances of becoming pregnant. Positive moods are correlated with increased chance of delivering a live baby, while higher levels of anxiety increase chances of stillbirth. Fertilization of oocytes are also decreased when stress is increased. A possible explanation may lie in stress hormone levels. Decreased stress level have been associated with improvement in fertility. So, because of the reason, psychological support have to be part of the multidisciplinary approach of infertility treatment. And this stress can cause that our diet can vary, but also can occur the consumption of substances that are not beneficial to health. One of the most common and social accepted is cigarette. It's well documented that cigarette smoke contains over 4,000 chemicals and is associated with a number of health complications such as cardiovascular disease, and it's a clear established link to infertility. Men who smoke before or during attempts to conceive have a higher risk of infertility in comparison to non-smokers. Men who smoke tend to have a decrease in total sperm count, density, motility, normal morphology, and semen volume. Smoking could reduce the mitochondrial activity in spermatozoa and lead to a decrease of the fertilization capacity, and also can impact on DNA integrity, leading to an increase of the risk of miscarriage. Women who smoke seems to have similar effects of consuming of cigarettes. The reduction of fertility may be due to decrease on ovarian function and reduced ovarian reserve. But the uterine tubes and uterus may also be target of cigarette smoke. Chemicals in cigarettes may impair oocyte pickup and the transport of embryo within the fallopian tubes, leading to an increased incidence of ectopic pregnancy, longer time to conception, and overall infertility among women who smoke. The other substance that is social accepted is the alcohol. Many studies have been conducted on the effects of alcohol and aspects of health, including fertility, obviously. While there are studies that demonstrate the link between alcohol and infertility, it's not entirely clear what amount relates to an increased risk. Some authors postulate that the limit put the limit on 8 units of alcohol per week. 1 unit has the equivalence of 20 milliliters of alcohol. In men, alcohol has been linked with many effects such as testicular atrophy, decreased libido, decreased sperm count, sperm morphology, and sperm motility. The impact is so clear that if a man consumes more than 80 grams per day, he can present complete inhibition of the production of the spermatozoa, that it's called in a technical word azoospermia. The positive aspect is that it can be reversible. The effects of the alcohol in men and in women are independent of the type of alcohol. So there is no alcohol would be better than the other. The beer is not better than the vodka, for example. And these effects depend on the amount of alcohol. Similar effects have been suggested in women. An example is the hangover. A common result of drinking is the hangover, and women who experience hangover were more likely to be infertile, suggesting and supporting that the amount of alcohol that we consume matters. The alcohol can have different effects on women, including increasing the time to pregnancy, decreasing the probability of pregnancy rate by over 50%, and decreasing the implantation rate because of the alcohol can cause anovulation, luteal phase dysfunction, and abnormal embryo development. Women with a high consumption of alcohol have higher risk of miscarriage and fetal death. If we continue on the topic of drinking, we have to talk about caffeine. Caffeine has become an integral part of society, with consumption varying from 50 milligrams in a bottle of Pepsi, for example, through 330 milligrams in a big cup of coffee from Starbucks. However, caffeine has been reported to have negative effects on fertility. Caffeine has been associated on women with an increase in time to pregnancy of over 10 months, particularly if the amount of caffeine is over 500 milligrams per day. The negative effects of caffeine that are emphasized in our recent research are miscarriage, spontaneous abortion, fetal death, and stillbirth. The woman who miscarried or had a stillbirth in that recent research that I'm talking about had an average of 145 milligrams of caffeine per day, and women who had live birth consume an average of 130 milligrams per day, indicating that there may be a narrow window for caffeine to impact fertility. In men, the published evidence suggests that the caffeine intake may negatively affect their reproductive function, possibly through sperm DNA damage. However, evidence from epidemiological studies of the effects the caffeine on semen parameters is inconsistent and inconclusive. So, leaving behind the so-called legal drugs, the other drugs, the illegal drugs, have a negative impact on fertility. Studies of the effects of illegal drugs on human fertility have been scarce due to ethical consideration, as well as the subject underreporting the consume of them and bias to the characteristics of the population being studied, such as low socioeconomic status or improper prenatal care. Marijuana is one of the most commonly used drugs around the world, and it acts both centrally and peripherally to cause abnormal reproductive function. In males, Marijuana have been reported to decrease spermatogenesis, decrease sperm motility, decrease sperm capacitation, and decrease acrosome reaction that is needed to a correct fertilization of the oocyte. Women who use marijuana are at an increased risk of primary fertility due to a hormonal disbalance and a negative impact movement through the oviducts and placental and fetal not properly development and may even cause stillbirth. Another commonly used drug is cocaine. The cocaine is a stimulant for both peripheral and central nervous system, which causes vasoconstriction and anesthetic effects. Long-term users of cocaine claim that it can decrease sexual stimulation. Men can find harder to achieve and maintain an erection and can find harder to ejaculate. Cocaine has been demonstrated to affect spermatogenesis, but less is known about cocaine's effects on women. Impaired ovarian responsiveness to gonadotropins in the context of an IVF treatment and placental abruption have been reported. The last group of illegal drugs are the opiates. Opiates comprise heroin and methadone. In men taking heroin, sexual function become abnormal and remain so even after cessation. Sperm parameters, specifically motility of the spermatozoa, also decrease with the use of heroin and methadone. And in women, placental abruption may also be a cause of infertility. But it's not only important what we consume or what we do, because in our everyday life, there are many potential threats to reproductive health through different sources. One of them is the radiation. Exposure to different kinds and different amounts of radiation can have lasting effects in humans. The incredible convenience of the cell phone has dramatically increased its usage in the last decade. However, it doesn't come without negative effects. There have been an increasing number of studies demonstrating negative effects of the radio frequency electromagnetic waves used by cell phones on infertility. Cell phone usage has been linked with a decrease in progressive motility, counts, and viability, and it's related to an increase in ROS and an increase in abnormal sperm morphology. In fact, one study that evaluates 52 men demonstrated that men who carried a cell phone around the belt line or hip region were more likely to have decreased sperm motility compared to men who carried their cell phone elsewhere or who did not carry a cell phone at all. In women, there is no evidence, scientific evidence related to the effect of the use of mobile phones because of the ovaries are inside our body and the testicles are outside of the body. But not only the radiation can impact on fertility. The type of clothing a man chooses to wear may have effects too. Many studies have been conducted hoping to find an answer to the question of what type of clothing is best for fertility. The view that elevation of scrotal temperature negatively impact on spermatogenesis and sperm parameters is universally acknowledged. But the question of whether tight-fitting underwear or tight-fitting jeans or pants or trousers have an effect on scrotal temperature and therefore to the semen quality has been long debated. There have been several studies that have found significantly higher temperatures with tight-fitting clothing versus loose-fitting or no clothing. They talk about an increase of about 3.5 Celsius degrees in comparison to the ambient air, but we have not worried about the skinny fashion because the effects of tight fitting are reversible. All my presentation, I've been talking about factors with a negative impact on fertility, but there are other factors with a positive impact. They are called preventative care. One of them is contraceptive. Contraceptives are often associated with preventing pregnancy, but several studies have demonstrated that both condom usage and oral contraceptive can preserve fertility. Oral contraceptives were demonstrated to have positive effects on the prevention and management of endometriosis. Endometriosis, if you don't know, is a chronic illness that relates with infertility. And the use of condom have a positive effects on the prevention of pelvic inflammatory disease. That is the first cause of tubal infertility in women. So, this evidence suggests that the contraceptive may increase a woman's fertility, lending to the overall fertility of the couple. Scheduling regular doctor appointments may be beneficial for fertility. Unfortunately, males tend to not seek medical treatment for sexual dysfunction or infection. It was reported that when men experience sexual problems, only 10% seek help. But when the problems become ongoing, 20% of men turn to health care professionals. For women, visiting the gynecologist to receive an annual check with a pap smear has been associated with a protective effect on fertility. Both pap smears and self-reported health status may be related to better screening for disease, STI detection, more available information, and overall better access to care. So as conclusion, lifestyle factors and other behaviors are modifiable and may impact fertility. The evidence suggests that age may play a role in determining fertility. Attempting pregnancy before the age of 35 for women and before 40 for men may provide the highest chance of success. Proper nutrition, have a proper weight, and do exercise may impact fertility. Exercise is suggested to be beneficial, though too much may be detrimental. We have to avoid smoking and moderate the consumption of alcohol and caffeine. While there are associations between psychological effects and infertility, it's hard to establish a cause-effect relationship. Tests are subjective, and there is no general consensus on how to measure psychological stress. By the way, couples attempting to conceive might try relaxing and reducing exposure to stressors in an effort to increase fertility. And if they need, they have to seek help by a psychologist. Taking care of a current problem may provide better fertility in the future. Taking preventative steps such as visiting your doctor and using contraception may help fertility. Other factors, such as clothing choice or lubricants, may also impact a couple's fertility. It's important to understand the way in which lifestyle behaviors may benefit or harm fertility in order to minimize complications and maximize fertility outcomes. By understanding the impact of lifestyle on reproductive health and by actively modifying lifestyle behaviors, men and women are capable of control their own fertility potential. Thank you for attention.
And wonderful. Thank you indeed so much for that lovely presentation with a lot of information. And
Yeah.
definitely sounds so easy, but when you are definitely thinking about all those things, it's definitely a lot. But thank you so
Yes.
much for bringing those to us. As I mentioned, we this whole week we've been talking about different lifestyle factors, and thank you for making this like a summary and what we should remember as well. And now it is time for our questions. As you can see, there are two questions, but someone is typing, so I'm sure there will be more questions coming up. So don't forget, if you have anything that's on your mind, go ahead and type this in, and Dr. Prados
Okay.
will answer it for you. Okay, Dr. Prados, ready to start with the
Yes.
questions? Perfect. Let's start with the first one. So, what do you think about heated tobacco like IQOS? Is it really safer than smoking?
IQOS has been very popular in the I think in the last 2 years, but there is no evidence that it is safe. For example, in United States, there has been an epidemic of a lot of young people that have seriously problems with the consume of IQOS. So the recommendation is to avoid smoking cigarettes and IQOS because we don't know exactly the substance that contains and the effects in a medium and long term on our fertility. So my recommendation is to avoid smoking.
All right. Thank you so much for that question, for your advice on that. I believe it's quite similar when we had those electronic as well,
Yes.
right? So at first it was okay, but then it turned out that it's not so great after all. So I guess
Yeah, for example, here in Spain, in the first time that we use ICOs or electronic devices that you said, they were allowed in the public spaces and private spaces, and right now they are forbidden. So it's
exactly.
clear that it's not a good option to give up the smoking.
All right. Thank you so much for that as well. Okay, let's have a look at the next question that we have from Maria. Does having the HPV virus affect IVF?
We have to know that the HPV infection is a very common infection. In worldwide, more or less 70-80% of population are going to have this infection. There are some studies about this topic. In men, they were related with worse seminal parameters, and in women they're related with a less good quality of oocyte, but we don't have any treatments to avoid it, to treat it. So we have to put the focus in the prevention. So we have to make a good management of vaccine program in the childhood. Not only the women, because we think that we have the screening of cervical uh, infection for women, but we don't have to forget that the vectors of the transmission of this virus are men. So we have to do a correct vaccine program to avoid this infection and to avoid the probable consequence of this infection in our health. Not only the fertility, to in a possible cancer, cervical cancer.
And thank you again, of course, for that.
Thank you.
And there's a thank you from Maria for you as
Thank
well.
you, Maria, for your question.
And Emma has another question. Would a high BMI affect a frozen embryo transfer or just a fresh IVF?
Yeah, a high BMI is going to affect an embryo transfer, frozen and fresh, because of the receptiveness of the endometrium. So we have to avoid everything that could be in our hands to improve our success rate, and the obesity is one of them. So we have to be in a normal BMI to have the higher chances of success.
All right. Again, thank you so much for yet another question,
Thank you.
your explanation, and thanks from Emma for you here. Okay, and next one is how much percent does lifestyle contribute to the overall success in egg donation cycle?
Yeah, I think I would like to make a question back. Is the question is with
Mhm.
the egg donor or the or the women who is recepting the oocyte. In both cases, the lifestyle affects. In egg donation, if you are the egg donor, is going to recipient. Okay, perfect. If you are the egg donor, is going to affect to the quality, and if you are the recipient, is going to affect the possibility of implantation. For example, is like the same question that we that I have answered before. The VMI, the novice women, is related with a less receptiveness of the endometrium and with a early miscarriage and spontaneous abortion. For example, with the smoking cigarette, of with the alcohol. So the answer is yes. How much in percentage? I think more or less 50%. It could be possible. It could be possible. For example, if we have the best embryo, if we have an euploid embryo, and if the recipient is a cocaine consumer, the possibility of stillbirth is very very high. So the overall success rate will be compromised. So I would say 50%.
All right. Thank you for the clarification to yet another question as well. There is a follow up, okay, from Maria. So let me go straight to that one,
Yes.
and we will go back to the previous one.
Okay.
You mentioned that vegetable protein is better. I usually eat mostly vegetarian, but have made an effort to eat more meat. How many eggs and how much chicken should I eat a week?
Yes. The best choice is the Mediterranean diet. Is like the animal proteins are needed because of the apports of vitamin B12. So if you are vegetarian and you would like to improve the consumption of meat, I would say, I think, 3 eggs in a week and 2 pieces of chicken. It will be okay.
All right. Thank you again for that advice. All right. There's a thank you as well from Maria. Okay. And there's a comment. Okay. Not a question, but a comment from the previous patient. Amazing living a healthy life. That is really worth it. Thanks for that.
Yes. But we have to be conscious that, for example, if we have an obsession with the exercise, it could be detrimental for success rate, as you can see with the bicycling in men. So is as I said in the presentation, and Aristotle would say, in the medium term. We don't have to we have an obsession with all the things that we do. For example, if we have a correct diet, if sometimes or one time I will like I prefer to eat a hamburger, or it would be fine.
So everything should be balanced as
Yes,
I
yes,
guess.
yes,
That's always
yes,
the best advice, I guess, as well.
yes, yeah.
Perfect. Thank you so much.
Thank you.
Okay, let's have a look at the previous question that we got. What
Vale.
can be done to prevent immunity issues regarding our lifestyle?
Okay, this is a difficult question because the immunology is a recent science and it's developing very very fast, and right now we know that we have more immunological illnesses that we thought that, for example, to prevent the inflammatory status, we have to avoid the use of a lot of technology, as cell phone, as Wi-Fi. We have to, for example, avoid to sleep with our mobile phone in next to us, and we have to have a Mediterranean diet, a good diet. It would improve, for example, inflammatory illness of the digestive system, for examul. But it's a very difficult question to summarize in in 1 minute. So is if Kat could focus the question, it would be better for me.
All right, of course, this is like a general question, but
Yeah, yeah, yeah.
thank you so much for answering that. If you would like to add anything, Kat, go ahead and do it. Okay, and let's have a look at the next question from Angela. What sort of things should one consider with a 3-month pregnant woman with a very active 18-month-old child, considering her diet?
Um, the a correct diet. You have to support with supplements as with iron. With the pregnancy supplements, normally have vitamin D, normal have folic acid, um, different type of antioxidants. So if you have balance a balanced diet with a high quantity of monounsaturated fats, for example, avocado or nuts or blue fish, and avoid industrialized bakery or fast food. And you have to prioritize the vegetable proteins to animal proteins, but we have to eat uh, animal proteins, for example, with meat or with fish would be better. It will be okay for a correct pregnant evolution.
All right. Again, thank you so much for that advice as well on the diet. Waiting, someone is typing. Okay, so, okay, let's have a look. There's a comment from Angela. Let's have a look.
Okay.
Yes, she takes prenatal, My Kind Garden of Life prenatals, vitamin D, extra folate, Carson's fish oils, which are wild caught. Is this okay?
Yeah, it's okay if you are taking the prenatal pregnancy, the prenatal vitamins. They have a lot of the amounts of vitamins and amino acids necessary to a correct develop of a future pregnancy. And if you have fish oil and you have the situation of wild caught is better because they are in a natural way growth. And probiotics. Probiotics. I am a really defender of probiotics. I think they are very, very, very important to the correct and the success rate of, for example, an IVF treatment, because the embryo has to be in a correct microbiota, in the uterus, and taking probiotics oral via or vaginal via are very, 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 very correct purpose to get a pregnancy.
Okay, thank you. Let's have a look. Okay, now the question is from Emma. What helps to lose weight? Sorry, what helps to lose weight can you suggest for a female with PCOS?
When the correct thing is with a female with ovarian polycystic ovarian polycystic, we have to know if you have a insulin resistance. This is the first step, because if you have a insulin resistance, we have treatment. Metformin, it could be better for you to help to lose weight, because if we balance the balance between insulin and glucose, we are going to help your body to assimilate better the glucose and to avoid the transformation of this glucose in fat.
Thank you once again, and there's a thank you from Emma for you. It's right here. Okay, next question is up. So I am sick and tired of my 100% whole grain bread. Can I eat some bread that is about 30% whole wheat, or would that be really bad?
This is that which we said before. We are not. We have. It's the extremes are not good, so we have to be balanced in our diet. Is, for example, is the example that I say with the hamburger. If you are sick and tired, eating have to be a pleasure. For me, it's a pleasure, and I think it have to be a pleasure for everyone. So if you don't like to eat this type of bread, you can consume another type of bread, limiting the consume of that type of bread.
All right, that sounds about right as well. Thank you so much for that as well. And there's a thank you from Maria. And can you suggest specific foods to support embryo implantation?
It's the same. It's a correct diet. It's a correct supplementation. For example, have been suggested that the supplementation with vitamin E can improve the strength of the endometrium. So with a correct diet, with a balanced diet, and with the supplements that your doctor could recommend you, for example, vitamin C, vitamin D, and coenzyme Q10 are in the last time very related with a correct implantation. So if we have a correct diet, if we have a correct supplementation with vitamin D and coenzyme Q10, it would be fine. I hope I have answered the question of Babel. It's important to know that there is no trick. There is not only one thing to improve the success rate. We are a whole system. We can't separate the different systems to think that if I, for example, eat a lot of one thing and have a sedentary life, the success rate will be perfect. So we have a whole system. Unfortunately, we don't have only one trick. It's like a different types of things that be a balance status.
Wonderful. Thank you once more for that addition to the question as well.
Yeah.
Okay, let's have a look at the next question. We will be slowly finishing. All right. So
Okay,
if you
perfect.
have any more questions, just go ahead and type those in. Let's have a look. Next question is from Maria. Shall I take probiotic pills if I also eat kimchi, or is one fermented thing a day enough?
So I have to reread the
Mhm.
question.
Sure.
I think if you are eating kimchi, uh, it's okay. So the probiotic pills, it would be fine if you, for example, have some frequent episode of thrush. It would be fine to supplement the kimchi with probiotic pills, for example.
All right, understood. Again, of course, thank you. And thanks from Maria for you as well.
Thank you, Maria.
All right, and I'm waiting for some more questions. If not, we
Okay.
will be finishing for tonight. But of course, already I would like to thank everyone for joining us tonight and, of course, for your questions. I do believe it has been very, very useful for you. And of course, Dr. Prados, it's been a pleasure to have you here. And thank you so much for
Yeah.
answering all those
No, no, no.
questions.
It's a pleasure for me. I would like to thank to the all the questions and all the audience that it's on Friday night here with us.
Exactly, exactly. Thank you so much. And well, in such case, we will be finishing. As you can see, there is one more thank you for helping. And of course, well, as you said, it's a Friday night. So thank you for
Yeah.
staying with us, spending this evening with us. And of course, as you know, we will be back here on Monday. So I can only encourage you to have. Relaxing, but also maybe you will be able to do some exercise and just follow a healthy diet weekend, just a little bit at least, right? Because after all, it's a weekend. But
Yeah,
um,
yeah. Thank you very much for the invitation, and I hope more webinars with you to explain everything that the audience have doubts. So thank you
exactly.
very much.
Thank you so
Thank you
much,
very
Dr.
much.
Prados, as well. It's
Thank
been a
you.
pleasure. And I
Thank
just
you.
also want to add that, of course, you will be able to find this on our website, My IVF Answers. And if you go to the website, you know that there are some previous webinars as well, so you can go ahead and check it. And of course, if you follow us on our Instagram, on Facebook, you know that there are plenty more events coming up. And actually, next week we have another head topic, which will be fertility assessment, and we will have another doctor from Vistahermosa, so on Tuesday. So I hope you will be able to join us as well. Once more, thank you so much. Have a lovely, lovely weekend. I hope to see you on Monday here as well. Dr. Prados, it's been a pleasure.
Good night.
Hope to be able to
Good
do it once again.
good
Thanks so
evening,
much.
everyone. Bye.
Take care. Bye.
Take care.